Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, April 7th, and this is my daily briefing. So currently we have 24 cases in Missoula. There are 319 cases in the state of Montana, and we have had 6 deaths in the state, with 1 fatality in our county here in Missoula. Yesterday, we shared some exciting news alongside the Missoula elected officials and some of our community partners. After a lot of hard work and weeks of planning and sorting through some of the resource challenges that we've been having, the Missoula County COVID-19 Testing Center is open today. That testing center is a drive-through facility at the Missoula County Fairgrounds, and it is by appointment only. So please do not drive out to the fairgrounds seeking a test unless you have gone through the process of setting up an appointment. If you do have COVID-19 symptoms, which are cough, fever, or shortness of breath, or you're caring for someone who has those symptoms and you would like to get a test done, please call 406-258-INFO. That is 406-258-4636, and select option number 2 to speak with the nurse. The nurse is going to screen you, and if they find that you are a candidate for being able to get that test done, they will transfer you to someone that can make the appointment for you. If your symptoms are severe, then you should contact a medical provider for assessment. That testing center is really only for people who are having a more mild form of the illness that do not need an immediate intervention. Missoula County residents who meet the CDC's testing guidance for groups 1 and 2 are eligible for testing at this testing center. The groups include people with symptoms of COVID-19 who have underlying health conditions such as diabetes, heart, lung, liver, or kidney disease, asthma, obesity, or are over the age of 65, those who are pregnant, or those who are immune compromised. Additionally, first responders and healthcare workers with symptoms are eligible for testing due to the patient interactions and their role in our healthcare infrastructure. We are not testing anyone who does not have symptoms. As we've discussed here before, there's a limitation of tests available, and the test is not designed to see if you've been exposed or determine if you're going to develop symptoms in the future. A negative test without symptoms just means that you do not have the virus on the day of the test. So with limited resources, such as what we have here in Missoula, the CDC does not recommend testing people who do not have symptoms, and it is limited to those people who fit in that priority groups 1 and 2 that I just discussed. We only have supplies right now to test about 200 people, and so getting adequate supplies has been a challenge in most areas around the country, and it hasn't been any different here. But we do hope to get more supplies within the week, and as we get a steadier supply of tests, we'll be able to test more people. For those who do get samples done through our testing center, those samples are then sent up to the state Montana Public Health Lab for assessment, and people will be able to get their results from the health department within 1 to 2 days, along with instructions for what we want you to do to follow up on that. So ideally, at some point, we will be able to test every single person who has symptoms, but right now with our limited supply of tests, we have to prioritize that testing and follow the guidance from the CDC about who falls into those priority categories. I'd like to again thank our partners and supporters who help make this happen, and those include Family Medicine Residency of Western Montana, Partnership Health Center, Western Montana Clinic, Providence St. Patrick, Community Medical Center, our elected officials in the city of Missoula, and also our elected officials in Missoula County. So I just want to say thank you to all of those partners. We wouldn't have been able to get this up and running without them. And the other thing I want to do today is touch on some of the questions that we've gotten regarding our numbers. Some numbers, like the number of positive cases, is really easy for us to track and report. Others are not as easy, as they change, or the tracking and reporting system is different and it's much more time intensive. Sometimes the best that we can give is an estimate, and I just want to kind of cover some of those numbers today. So I want to talk about hospitalizations and recovery. A lot of people want to know how many people have been hospitalized with COVID-19 in Missoula. So right now, there have been 4 people who have been hospitalized to date in Missoula, and only one has been put on a ventilator. Reporting the number of people hospitalized for us and for the state can be really challenging. Whether someone is hospitalized for COVID-19 related issues can change throughout their infection. So the numbers can vary throughout the day, which makes it really hard for us to report those numbers accurately. Additionally, not all people hospitalized are on ventilators. Sometimes a hospital is the only way to isolate the person and provide the care that they need, but that doesn't necessarily speak to the severity of their symptoms. People also want to know about recoveries, and we totally understand that. We want to be able to share some positive news in light of all of the distress that we have going on and all of the disruptions to our daily lives. It's really good to hear something positive. So currently we have 10 people who have recovered with our first recovery on March 22nd. Missoula uses the CDC guidelines that have come out for determining at what point someone is considered recovered without the additional testing. So those guidelines are at least 3 days or 72 hours have passed since the resolution of fever without the use of fever-reducing medications and improvement in their respiratory symptoms, such as their cough or their shortness of breath, and at least 7 days have passed since the symptoms first appeared. Other entities may use different CDC criteria to determine patient recovery, but with our limited testing capabilities, we are going on that CDC guidance that does not include having additional tests done. So we will do our best to report these to you, but we may not be able to do that daily. We just want you to know that it does, some of these numbers change very frequently, and it makes it a little bit harder to track down the correct numbers. So we just want you to keep that in mind. The other thing that we want you to keep in mind is that those numbers can change from the time that I record my daily briefing and the time of the posting, and that things can change throughout the day. So when maybe I'll be saying something in the morning and by afternoon you're hearing something different, and it's just because those numbers are constantly changing. So that's all I have for my daily briefing today. As always, you can subscribe to me on YouTube to get these briefings. You just got to click the little bell to get notifications whenever a new video is posted. You can follow us on Facebook at the Missoula City County Health Department. You can check out our website at missoula.co/cvirus. And if you have any questions or you want to find out if you'd be eligible for a test, call 406-258-INFO, and we've got people answering the phone over there Monday through Friday from 8 to 5. We will certainly increase those hours if we find that we have a need for that, but right now it is Monday through Friday, 8 to 5, 258-INFO. So until tomorrow, stay healthy, and thank you for everything that you all are doing in the public to keep our communities in Missoula County safe.